Hi, evening. Happy Friday. I was just talking to my mate and I'm like, why is Friday any different from frigging Monday and Thursday and Wednesday when you've got bloody kids and a frigging messy house to tidy up tomorrow? Oh my God, these are shocking. Right, so this is going to be epic. We're talking to a serious professional here who's walked the walk. She lost 35 kgs when she mastered food addiction. I love it, thank fuck it's Friday. I mean, I'm still sat here. Everyone has gone home except me. So yeah, I'm home alone here. Right, so Public Health PHC. I'm trying to locate her. There's too long till she joins. I hope everyone's having a nice time. I've had a look at some of your questions, but listen, she's just going to keep talking, so you can just put your questions here and I'll filter them through. Hi, Olivia, how are you?
I'm so good. How are you?
Really good, thank you. I'm last man standing in the office, so I've drank a few bottles of kombucha.
Oh, bless
So
you.
bear with me if I chatted too much.
Let me just turn my volume up.
Let's get first things first. You're doing an event in Croydon, aren't you? Let's just get that out of the way because you're going to give away a couple of tickets, aren't you?
Yeah,
And I'm going to be
absolutely.
there.
Really excited about that.
Okay.
So yeah, we're having an event in Croydon. It's on the 18th and 19th of May, and it is bringing together all of the world's leading experts on metabolic health and people who really understand how we should be eating to avoid getting all the chronic illnesses. They're all coming to London from around the world. People might know a few of the faces, and it's really exciting that they're going to be here. And we have 2 days of talks from them. We have some debates, really, really good debates on whether cholesterol causes heart disease, whether red meat shortens your lifespan, and we've got some really great experts on either side that have two different viewpoints, because that's the most common conversations and questions that people ask when they start to figure out what they're trying to do in nutrition is like, do I need to worry about my cholesterol, and am I should I have a concern about red meat? So we want to tackle those head on, and we've got some great people kind of arguing different sides of those two different questions. So we've got Anthony Chafee and Ben Bickman on the red meat one, and we have Dave Feldman and some of his team, Adrian Sotomoto, on the other one, and then we have some more like establishment mainstream people on the opposing view, and we're going to see how it all comes out. So we did a debate last year for the first time and it worked really well. And so we're very much planning for that to happen again. It's not going to be in any way a big brawl. It is going to be very respectful. We want people to be really informed by it. We want people, when they're searching on YouTube to find the answer, that to actually get all that information directly comparable and easy to access. So that's the intention with that. But so that's going to be very exciting. But then we've got loads of other speakers. We've got Gary Torbs, who's one of the experts in diabetes, Ken Berry, all talking with David Unwin about how we are going to turn around this type 2 diabetes epidemic that we're in. So that's one area. Another big area is mental health. We've got some great UK doctors that are doing some of the leading research, coming to talk to us about how they are finding a ketogenic diet really helps with things like bipolar and other mental health issues, and they're going to share all of that. We have a whole panel on ultra processed foods and how we can save our kids from having, encountering all the dangers of ultra processed foods. And we have Eddie Abu coming to join us on that panel.
I just want to speak to you about Eddie Abu,
and Jane,
because I mean he's really outspoken and everything, but I think he's doing a lot for the attention, and he takes a lot of flack, doesn't he? He gets a lot of this because, oh, you're not this, you're not that. But surely you just have to be a human being to have a qualification on what food does to you. And just because something isn't in a peer-reviewed study, anecdotal is enough. And I think that that's what we need to understand, that, and particularly because you liken to mental health is impacted by what we consume. I mean, it's so obvious that just because you have different departments on different floors of hospitals doesn't mean that your body separates from neurology to gastroenterology to, podiatry. I mean, everything is impacted, hasn't it? And I think because he's so noisy and so shouty, that he's got this epic following of people who are half the time there for entertainment, but his message is kind of pretty simple, isn't it? You know, and he obviously,
it's very simple.
yeah,
And he's
you know,
executing it with humor, so people love him. And he's just basically taken a sledgehammer to some of the biggest nonsense out there, and so that's
when
getting through
do you
to people.
think it's going to backfire and he's going to be cancelled?
Well, hopefully not before the conference because that wouldn't work. I hope never. I think he's on a roll, and I think people are. I was actually in his community for a little while, and people are really big fans of him.
Yeah.
Like, they just love him and they just adore what he's all about. And so I think it's going to be very hard to cancel him. You know, they're going to have to find a serious, you know, skeleton in his closet. And just yesterday he was asked about protein powders and if he sold them in his gym, and protein bars, and he made a video about that. So he's kind of quashed that one pretty quickly. So if that's all they had to go on, you know, what they can't do is really get away from his message, which is all about real food. I think the strongest argument against Eddie is, oh, but he is, you know, it's all about moderation. You should be able to have whatever you want to eat. And he's just saying that is pussyfooting around all of this. That's wrong. We should be being very clear with people about what the right thing is to eat. If they choose not to eat that way, that's their choice, but don't patronize them and not give them the right information. And I think that's where we are as well.
Right.
Our thinking on
so that brings me nicely round to food addiction. Now, as a recovering alcoholic, oh, have I lost her? Oh, have we lost her? Are we okay? Eddie Abu, by the way, that's his name. Have you? Am I okay? Am I still coming through loud and clear, or have I lost her? Oh, I hate it when this happens. Have I gone? Hi, have I lost
I'm here.
you? Am I back? Great, you're back. Fabulous.
I'm
right.
back. I don't know who's back. We're both back.
Okay, so it just brings me nicely round to food addiction. So as an alcoholic, right, I can spot another one a mile away. There's a saying, you know, it takes a thief to catch a thief. And I'm also, my secondary addiction is carbohydrates. And can you explain how that works? How would a carbohydrate, a humble carbohydrate, trigger the brain to say, I'm not satisfied, I need more? Oh, damn. I've got full signal, you know. Oh, it's one of those Friday night things. Do you reckon everybody's just dear me? Have I got on? Shall I just wax lyrical till she comes back? Let's see, what other questions have we got? Oh, hi. Sorry, I lost you completely then.
I'm sorry, I don't know who it is. Mine seems to be okay, but
anyways,
let's have another go.
So yeah, explain how a carbohydrate can trigger an addictive mechanism in the brain.
Well, I mean, it's particularly processed carbohydrates and processed foods that can do that, especially kind of the sugar aspect as well. And there's lots of components in processed foods that you think it's maybe the carbohydrate, but it's probably some of these other ingredients that can really mess up your brain. And they are designed to be hedonistic. They are designed to have a combination of fat, sugar, salt, and certain things that all come together. And not to say that fat and salt are necessarily bad, but certainly the sugar element, when combined with them and designed that way, really does act like any other addictive substance as far as your brain receiving it, your dopamine receptors latching onto it and getting a bit of a high. And they just established last year in a study that about 14% of adults have a food addiction, an ultra processed food addiction. And it's a very similar level to what you'll find for alcohol and for nicotine and other drugs in society. I think alcohol may be a bit higher, but there's equivalent number for kids, so 12% for kids. Whereas for alcohol and for drugs, you don't have a kids number because we don't give kids addictive substances, unless they go and help themselves to it. But we don't, we don't, in society give out addictive substances to kids, and that's what we are doing with carbs and sugar a lot of the time, unfortunately. And we're setting ourselves up for more and more of the same addiction to perpetuate into adulthood. And that's why, we have 50% of our calories more now are ultra processed. We have the highest obesity rates in the whole of Europe. And our kids are not on the right track to go against that. They're going in that direction to make that that even worse. So we are doing a lot of work on food addiction. We're trying to actually set up a whole program to coach people away from being addicted to these kind of foods and to really get under the skin of what the addiction part is. For some people, it is an actual addiction, and you can do a little test to either see if you are addicted in that way. And if you are, then you probably need some help, which is more than just having to use your own willpower to get away from these foods. So we have a food addiction service that we're designing to help people reverse food addiction at the moment. And it's looking really promising.
Sorry to interrupt.
Yeah.
How do you test that? So would it be like for me to go into a pub and just have a glass of wine and see what happens? Because I know what I'd probably do with that situation. Within 72 hours, I'd be back to morning drinking, just because I know as an alcoholic, because of thousands of people before me, say within a week, you go back to where you left off. How do you do that test? And particularly because food's such a grey area, because we've got to eat. I mean, I don't have to drink alcohol. So how do you isolate those key ingredients? What do you do?
Well, we have so we're doing a study at the moment, and it's a pilot with 100 or so people, and we have put them through all of the assessment to see that they definitely, based on the Yale food addiction scale, they definitely are food addicts, specifically ultra processed food addicts. And then what we are doing is coaching them to deal with what the psychological aspect is of that addiction, and to actually hone in on it and try and address it up front and find out what any kind of underlying emotional or other triggers are that are contributing to them having those types of addictive behaviors, and then trying to help them and give them tools to manage those issues a different way. And so what we're seeing from very preliminary results is that people are saying, after having gone through this course, is that they're less socially anxious, they're less likely, they don't have any of the symptoms of having to go back to all of these foods that they've always felt like compelled to go and eat. They're not feeling that way anymore. So it's claimed data, and it's still early stages, but it's how they are responding and how they are claiming that they feel differently. And a lot of the time.
How long is that course, that sort of mental shift? How long does that last? Is it 30 days, as in rehab?
It's 6 weeks, and it's about, I think it's different sessions during the week throughout those 6 weeks. And then what's really important about it as well is that it's a whole community of people that are all helping each other along, and apparently that has played a huge part in people actually finding a way through, and really seeing some positive results on food addiction. So it's very early stages yet, and we haven't published any of this yet, but it's looking really promising that people are finding a way to actually deal with food addiction. And so I think we're going to be needing a lot more of this to be available for people, as they, especially those kind of yo-yo dieters, people who've tried, they managed to lose weight, and then a few weeks later they're back on it again, because what they didn't do was deal with the addiction side of it. And that's why people say, oh, I tried giving up carbs and I couldn't. Well, there was probably something else going on that you needed help with, as well as just getting off the actual, the kind of the carb addiction side of it, but actually the food addiction side in general. And your need to have, be compelled to go and eat certain foods, that needs to die. That you need to have total freedom from that to be able to say that you're not addicted. And which is why we really struggle with the idea of, this is all about moderation, because as soon as you bring moderation into the picture, you are putting people back on the track where they're getting a taste of something which is addictive and which is going to pull them back into that addiction again. And so, whoever thought we have to have the choice of every single food that, manufacturers have invented, and that needs to be part of our choice in order to stop ourselves from getting some kind of eating disorder. We don't know where that's come from. We're actually looking through the literature and using some academics to look through the literature right now and say, where is the evidence for that? Where is the evidence that restricting any food type is going to perpetuate an eating disorder? We think it might have come from people in the past trying to lose weight and trying to stop eating the wrong food, and probably going on a low calorie diet. Probably being quite ravenous because they're not eating, their body doesn't have the nutrients that it actually needs, and then ending up back in a kind of a binge eating situation and perpetuating an eating disorder that way. So maybe that's where it's come from, maybe that's where it's happened before, but that doesn't mean to say that it always happens. If you're eating the right diet and you're giving your body the right nutrients, that doesn't mean to say that you're going to be perpetuating an eating disorder. It can't be true that eating the wrong foods is doing something bad for you. You know, eating the right foods has to be the way to
I
go.
suspect it's come from someone like Mars Company. That's where I suspect that little phrase has come from, like eat little and often, and breakfast is the most important meal of the day.
Yeah,
I
count your calories.
suspect that that's just trickled down, like the low calorie, calories in, calories out. It's become a religion, and somehow the doctors have found it so easy to say everything in moderation. Every TV doctor will say, yeah, but everything's fine in moderation. Or what, like crack? Is that okay in moderation? Because that's
Exactly.
what we're dealing with. We're dealing with children having something that works on the same receptors, and they're not going to find joy in anything else. They're not going to find joy in football. They're not going to find joy in climbing a tree, because their brain, their dopamine system has been so overworked that I know, as a recovering alcoholic, that when I was coming off active addiction, I couldn't see the sunrise. I couldn't see the sunset. Everything was beige. And it takes a lot of work to get you to feel good again,
Yeah.
and to be able to go, frigging hell, I'm happy with life. And gratitude is massive.
Yeah.
Right. Withdrawal. So we've got a load of women on here saying, there's one woman actually who said she's just, after 15 years of having oats, she's decided to come off oats, and she's in a serious case of withdrawal. Can you explain how to hack around that? I mean, I'd just say MCT, or just load up on nutrition, just get as much B vitamins and everything down you as possible. And like I said, do not count calories. What do you do in that situation? Because you've been there, you know what it's like. You
Yeah.
lost 35 kg, which is insane.
Yeah. Yeah. But once you know how, it's actually not that hard.
Okay.
It just happens, right? I think if you're eating real food and you have high fat as part of that, and you're keeping your carbs low, so you're not on a sugar high, and that you're having to recover from all the time, that you're trying to build up again because you're fueled by sugar, and you start to become fueled by your own fat, you're in a such better position to be able to handle the pressure of any of those kind of cravings. And so what happens then is that if you are having a lot of fat, you have real satiety when you eat, not hunger that you're trying to fill up your stomach with bulk, and it's not sugar that you're trying to give yourself a sugar fix. It's real satiety where your body is saying, I need nutrients, and I want the nutrients that I will get from mostly kind of meat and vegetables. And once you're filling yourself up with that and enough of that, you will start to feel at real satiety, not satiety like any kind of other fix. And your body will not really crave for stuff to start with if you can get that right. And you said MCT oil, that could be another way to do it. If you're getting fats into your body, it really, really helps you protect yourself against any of these cravings. And, you know, in those early days, I know it's really, really hard. Like if you're fully on UPFs at the moment or on high sugar fixes, and people do that even while thinking that they're healthy. You know, I thought I was really healthy, and I cooked everything from scratch for many, many years. But you know, I would still have a bit of chocolate after dinner. I would still have, you know, an oat smoothie in the morning with some bananas. You know, it's those kind of things which, you know, we think are healthy, but they're still keeping us on, you know, a sugar high all day, and starting us off a lot of time in the morning. So if we can, to get from there to go straight cold turkey, I think can be really hard. And so I don't think there's anything wrong in having some of these products which have sweeteners in it for a very fixed amount of time to get yourself away from the real sugar and get yourself weaning down off needing that. But I would say just for a matter of a couple of weeks. And that's what I used when I first started, because I had to have, when you have that craving and you just have to get something, you're going to end up eating sugar, you're going to end up eating real chocolate. So get it out of your house, get all of that stuff out of your house, have something which is a substitute for a little while, but you want to get yourself off that too. It's like the methadone of, you know, getting away from the worst stuff towards something which is more manageable. And just avoid buying any ultra processed foods with sugar in it, the carbs in it, especially if they're in the first 5 ingredients on the ingredients list. That means that it's pretty high up there. So just try and get to real food as much as possible. Get rid of sauces, get rid of things that have all those hidden sugars in it, and up your fats, and you will feel totally different. And especially with oats, because that is, you know, in the morning you're going to have a glucose dump from your liver into your blood. You don't need any more sugar, so you need to be staying away from carbs in the morning, and then try and put your oats back an hour, and then back another hour, then back another hour, and you'll end up getting to lunchtime and not needing it at all, and then it's gone. And then you can have a proper lunch, you know, with some eggs or some avocados or some fish or things like that, which have good fats in it.
How did the whole overnight oats, oat milk, whole grain phenomenon take over? And when did it take over as this is what you have to have constantly? Where's this fiber thing come from as well?
Well, I mean, I guess it goes back to the whole story of dietary guidelines and influences from certain institutions that also were connected from the point of view of having a breakfast cereal, and at the same time that we believe that saturated fat was bad for us, we also had the influence from the same group of people from the food industry, and they were very much in the place of trying to reuse a lot of post-war food products that they were trying to turn into something that we could use. So they created high fructose corn syrup. All the breakfast cereals were available. They were all considered the right energy source. If you can get rid of fat, you're going to need to have carbs. It's just one creates the other. And so since then, and as soon as you put your fat down, you're going to have to increase your fiber, because your fat is what actually helps digestion, helps your stool soften. And so if you haven't got that, then you need the fiber. So we don't need fiber if we are doing, having enough fat to start with. But we definitely think we do. So that's a little bit of reverse learning that we have to unlearn in terms of fiber. I mean, it's fine to have fiber, but you don't have to have it, and you certainly don't need the fiber that you get in processed foods, which is very processed.
Yeah. I mean, when I went carnivore in January, I'm going to talk about poo now. And I was concerned that I was going to get constipated, and I generally am very regular, and it's like in the morning. Now, when I went carnivore, it actually, I'm sorry about this, but it went to the evening for 2 days and then went back to the morning, and I was just regular. There was never a point that I didn't go to the loo properly, for want of a better word.
How long did you do
I
it
didn't
for?
bung up at all. I mean, I don't know if it's because I have so much fat in my diet, so much MCT, so much of like the keto powder, so much red meat. I mean, I'm not scared of fat at all, and, obviously I knew that if I was going to stay away from my usual suspects, even flipping like salad I was craving at one point, just to be naughty. I just knew it. I had to have a ribeye. I had to have it with the fat on. I had to have the butter, and I ended up having yogurt anyway. And we've got a protein powder that's bone broth based, and it's got keto powder in anyway. So that's a fatty protein that's carnivore essentially. But the whole not being constipated was quite fun to report, actually.
Yeah, I mean, constipation is more about the hardness of your stools rather than the frequency anyway. So if you were going every day, then obviously you have the frequency, and if it wasn't hard,
no, well, it wouldn't be, because I've got no bloody like all bran in me, which is basically just sawdust, isn't it? Which is just bulking agent, right? Great fiber provider.
Yeah, absolutely. So I mean, if anyone finds that a lot of people find when they do go carnivore that they don't go as often, and that's pretty normal, because you're absorbing like 80-90% of what you're eating if you're eating just mainly red meat. And that's the most bioavailable, the most nutrient dense food that you can eat on the whole planet is ruminant meat. And if that's all you're eating, then most of it is going to be getting absorbed, which is great for you because you're getting all the nutrients that you need. And so there's very little, unless you're eating gristle, it depends on the cut, there's not much going into your waste. And so you probably won't, people who are kind of regular on carnivore probably don't go, more than twice a week.
Well, I was having Greek yogurt as well, so I don't know, maybe that might have been, I don't know, because I tried. Matthew did it, and he just did it without all the Greek yogurt and all the faffing. I kind of look forward to having something different at night, because I fast throughout the day. I fast throughout the day, and then I kind of really missed rocket and cucumber, weirdly. It wasn't cakes I was after, it was cucumber. But I digress. Anyway, so can you tell me about your weight loss journey, please? Someone who's been there, done that, and just tell me where you were up to back then. Like you said, you thought you were eating healthy. So what was your average day like when you were heavier, and how heavy were you?
So I was, gosh, I can't think, about probably 90 kilos maybe. I'm not very good at remembering my weight, but apparently I've lost 35. I have lost 35. but I was, as I said, healthy, low-ish fat, eating all real food, running. I used to run nearly maybe 5 times a week, and really dedicated to all of that. And I just had resigned myself to not probably being able to ever lose this weight. It was just, something that had happened, and I thought that's my body type and whatever. So I wasn't really bothered about it. But I did have I left a corporate career after 20 years, decided I was going to start investigating how to prevent myself getting Alzheimer's and type 2 diabetes, because that's what my parents both passed away from. And while I was doing that, I started listening to different doctors, and I was sprint finishing a run one day, and I was listening to Dr. Eric Berg, and he said, "Good luck burning fat if you've got sugar in your blood." And as I was sprint finishing, I had to stop dead in my tracks and just take in what I just heard, because I had just not really grasped that concept before then, which is, whilst you're feeding yourself in sugar, your fat stores are locked away and they're not moving anywhere. You have to get your sugar down. You have to allow insulin to go down to release your fat stores. And I hadn't appreciated that fact quite late into life, probably, which blew my mind that I hadn't done that.
And just remind me what sugar is. What converts to sugar? Because this is why the oats situation is.
Yeah.
Can you explain, just for everyone, what is sugar?
Sugar in your blood is mainly glucose, and that will come from anything which contains a sugar count at the back of your back of the ingredients, or carbohydrates. So whatever you do when you look you should always read your ingredients, always read your labels. If anything has carbohydrates, look at that number, carbohydrates of which sugars. That is the number that you are taking in as far as something which is going to turn into sugar. And it really doesn't matter if it's carbohydrates or it's sugar. It just maybe takes a little bit longer to get into the sugar form, but it's still sugar in your blood at the end of the day. And so as long as that's in your blood, your insulin is going to be up. And as long as your insulin is up, you are not releasing any fat. So it really doesn't matter what else is going on. You're just not able to lose weight.
And then why does the body do that, Olivia? Why does the body suddenly switch off fat burning if you've got glucose whizzing around, albeit from whole grain bread or pasta, whole grain pasta, all of it from all this fibrous stuff? Why does it switch off fat burning?
Your body has to choose an energy source, right? So if you're giving it glucose all the time, it's going to use glucose, and it's going to also get rid of that glucose as quickly as it can from your blood, because glucose in your blood can be very dangerous. It can cause all kinds of issues in your organs and other places. So as soon as sugar enters your blood, it's being delivered to all of the cells that can use it for energy, but the insulin is what is helping it get into those cells and store, and especially when you've kind of used it for energy, to store it as fat. So whilst that insulin is high, your body is in a mode of fat storage. And if it's in a mode of fat storage, it's not going anywhere near the fat cells to take any fat out. Because it thinks it's getting sugar all the time. And that's why you think 3 hours after you've eaten one meal that you're hungry, because you're not. Your body's just saying, well, now I've run out of sugar, what should I do? Because I'm used to fueling myself on sugar. So please give me more sugar. And then you go and have something else which is sugary. So you just stay in this perpetual state of having insulin high all the time, because it's never coming down enough for you to ever access your fat stores. So until you can get your insulin down, until you can allow your body to say, oh, I don't get to use sugar anymore, now what should I do? That's when your body says, oh, I remember we've got this backup fuel source, it's called fat. I better go and get some, better start using it, breaking it down, turning it into ketones. And then your insulin is very low, and all your body is doing is taking all that fat out of fat stores and using it as your energy. You feel 1,000 times better when that happens. I found my fitness performance got better. Your brain alertness is amazing. It really helps with people feeling, kind of mentally depressed or anything like that. It really lifts that. So many other benefits come that you don't even think about until you realize that, God, I just feel so much better when I'm fueled by fat. And so a lot of people who are athletes as well say, how do you do it? You have to have sugar for running, for doing any kind of exercise, but you just don't. Your body, I wake up every day.
Your body makes it anyway, doesn't it? Your body, through is it gluconeogenesis? So if you have protein, your body breaks down protein into glucose, which then fuels you. there is no need to carb load. It's not 1984 Italy doing like the Italian, like, you know, they used to do that Italian football thing. They used to carb load, and they
Yeah.
also used to drink loads of red wine and smoke loads as well.
Yeah.
But it's kind of dated thinking. I've ran a half marathon in ketosis, actually, and it was
Yeah.
fine. And I felt exactly the same. I didn't feel a high or anything, but I run every day. I do 7K
Yeah.
every day, and I am completely and utterly in ketosis. And
Are
I
you
stay in
fasted when you do that?
ketosis. Sorry?
Are you fasted when you run?
I am coffee and MCT and keto powder,
Okay.
or sort of coffee creamer. It's just that is what I
Yeah.
have. And then after that, I'll have MCT oil, and I'll overdose an MCT oil because I get a bit of a brain buzz, and I get a bit starry eyed. I generally like to walk around in a daze. So that's the old alcoholic in me. But, you know, each to their own. But that I remain in a fat fueled state all day. But at night, I will have carbohydrates because I find I sleep better.
Ooh.
Can we talk about that? Can we talk about full ketosis and then keto cycling, and, you know, just so people aren't quite so scared, because a lot of people, I mean, I held on to sourdough for like years, which is better, but I can leave it now if I want to. We've got some in the house, but I'm kind of like I'm all right, you know. I'm having a bit of a bulky salad, and I'm having loads of fruit and things like that, some bananas and stuff before I go to bed. But talk to me about how you can adapt it so you'd still get excited about food and had the benefits of dipping in and out of ketosis.
Well, I mean, if you go as far as carnivore, you're probably not in ketosis all the time anyway, because you tend
Yeah.
to eat once a day, and it's a big bolus of food normally, a lot of protein if you're eating steak, and so you probably come out of ketosis very naturally if you're eating that way. You're not always in ketosis all of the time, and it's good to come in and out, but I have never found that it's good to use carbs to do that. Like, I think there's other ways that your body is going to do that naturally without you having to use carbs. And I do know some people that thought they needed to have carbs before they went to bed to get a good night's sleep, and they switched to having butter instead and found that did just the same trick. So that might be a way to do it. You may not need the actual carbs to do it. There are no essential carbs, in case anyone's wondering. There's essential amino acids, there's essential fatty acids. There are no essential carbs. Your body doesn't use it for anything apart from energy. So if you can, I think the less of it you can have, the better off you're going to be ultimately from many, many perspectives.
Can you just explain as well, what about hypoglycemia? So people who are borderline insulin resistant, and I think a lot of people don't understand that they are, because most doctors will just take your blood sugar, and that'll look normal, but meanwhile in the background, insulin's working 10 to the dozen,
Yeah.
processing all these carbohydrates, but but it's doing its job, but it's working very hard. When you come off the carbohydrates, you get shaky and stuff. Can you explain what's the best way to do that? Because people get scared. People get really scared. How do you do that?
Well, how do you lower your I mean, I think what you're describing is basically hyperinsulinemia, which is your insulin is working really, really hard to keep your blood glucose at the right level, and that is basically a sign of a metabolic issue, and it's just going in the direction of making you pre-diabetic at some point. So if you're there are some tests you can actually do where you can look at whether or not your insulin and your glucose are close together. So is it taking just enough insulin to get your glucose down, or are you having a massive amount of insulin that your pancreas is having to produce to get the same amount of glucose down? And you won't know that by doing a fasting glucose test, because your glucose is going down either way. What you want to know is, what you ideally want to have is a fasting insulin test, which tells you whether your insulin is elevated, and that gives you a better clue, or a Kraft test, which does the whole area under the curve, and you can see how tightly they work.
What was that test again? I'm going to do some show notes. What was the test? The fasting insulin, which you've got to do at your doctor's.
Yeah.
And what was the other one?
I don't even know if doctors always do it. I think you might have to do it privately. The other one is a Kraft test, which actually,
as in
Kraft.
As in Kraft Foods?
Yes, with a K.
Ironically. Right,
yeah.
Okay.
It's actually named after someone called Joseph Kraft, who invented it. He's a scientist. But he looked at how closely the two curves went together, and then you can kind of establish how insulin resistant you are, basically. And that one requires you to have like a glucose tolerance test over many hours, and then you know whether or not your insulin is going up and up and up to kind of get it down or not. So those kind of tests are out there, but probably most people won't have access to them. I mean, the best way, you don't have to test, if you're insulin resistant or not. You just need to eat in a way which allows you to not be insulin resistant, which is to just get your carbs down. Because, I mean, what's it going to tell you? It's going to tell you you've got to get your carbs down, you've got to get your sugar down. And that's the right thing to do anyway, whether or not you are insulin resistant at this point in time, just to prevent future disease, prevent, Alzheimer's, prevent cardiovascular disease, all of those diseases that we're so scared of, that we've seen people die of, that we have, 8 out of 10 NHS beds are being used for at the moment. And we keep talking about how we can spend more money on the NHS instead of trying to reduce how many people need to use the NHS and have a better quality of life. All those diseases, just get rid of your carbs and sugar and your ultra processed foods, and we will be a very different society as far as our health.
Tell me, a lot of people, I mean, I was definitely one of them. Some people say, oh, I can't eat when I'm stressed. I'm like the opposite. I stuff. And am I right in thinking that carbohydrates, because of their opioid mechanism, actually lower cortisol? I mean, they make me dopey. Fact, I feel gormless after I've had a sandwich or something. Can you explain how, if you're in a stressful situation, you might hack around that without leaning into carbohydrates, cigarettes, or a glass of wine?
Oh my God. Stressful situations. I don't know. I think once you've got yourself away from carbs, I don't think you use them as a crutch like that anymore for stress. It doesn't occur to me, like, I've been very stressed recently for different reasons, but it hasn't been like, oh, I need to go get something out of the cupboard like that. Once you've unlearned that behavior and you don't have that physical dependency, the mental dependency just goes away over time. Maybe what you can do is have, some people give advice that, have a different fix that you can get, which is less of an issue, like a decaf coffee or whatever it might be, something which, in your mind is your go-to, which is less offensive than some of the other things that you could have, and get rid of all the other things that you could have. Just don't have them there. And you'll be
it's incredible how we can, within a week, first of all, change the eating cues. So like, if you, like you said at the beginning of the talk, you can shift your eating window by like 15 minutes a day. It's incredible how the body doesn't notice the clock. And all of a sudden you can really, it takes a little bit of effort in the first 2 days, but all of a sudden you whack some sort of behavior in the middle of it, be it, I don't know, emptying the dishwasher, doing something else, even having a shower, but doing something that just extends. Instead of having something at 7:30, you have it at 8:30. It's incredible how the hunger cues, the idea that you're not even actually hungry, let's face it, your stomach's not gurgling, but that signal to seek food changes so quick. After 35 years of eating a certain way, within 24, 48 hours, you can rewire that brain, right?
Oh yeah. I mean, I think, again, once you get carbs out the picture, you are in a place where your body is just telling you when it's actually hungry, actually needs nutrients. And that ends up being more like once a day for a lot of people. So most of the time, I'm not hungry till 4 o'clock in the afternoon. I might have a little snack then, which might be, I don't know, some sardines or something like that. But most days I will end up just going straight to dinner at like 6 o'clock and having a piece of meat and nothing else, or something on the side. But that is the first time I get hungry. That's my breakfast, basically. That's the first time I'm hungry in the whole day, because I'm eating when my body needs nutrients, and I'm not looking for food as any other source of anything apart from nutrition. That doesn't mean that I don't love my food. Like when I sit down in front of a steak, it is the most beautiful, amazing experience eating a steak, compared to, a bowl of cornflakes or whatever else people are eating. That is not pleasurable food to me. I would much rather eat the best food I can possibly eat less frequently, and have the freedom from all of those other things that kept me tethered and making me think that I need to go and get them because they're calling my name. Yeah, they're out of the picture. They might as well, if I saw a packet of biscuits now, it would be like looking at it would be like a piece of cardboard to me. I mean, it would mean nothing. You can get yourself to that state where none of these things have a hold on you, and it is a much better, healthier place to be, a much better relationship with food. It is not an eating disorder. it is a healthy relationship with food, because you're not tethered to it. You are not pulled in, which I think is more of an eating disorder, when you are actually bound to a packet of something that you know is in the garage, that you're thinking all day, when am I going to go and get it, and you're trying to resist it, and that's in your mind all day. That is an eating disorder. That is you saying, I don't want to eat that, but I don't have control over whether I do or don't. At some point I'm going to lose that control. That's not freedom from food. That's not a healthy relationship with food. That is an eating disorder, in my opinion. So I think people, really should just maybe try some of these things and see how they feel, because, as you said at the beginning, Davinia, the science is, it kind of doesn't matter for some people, because all that matters is your N=1 and how you feel and how you deal with these things and how your body deals with it. And a lot of people find, I think, especially the ones that, what Eddie says is that the people just tell them it's working, and that's all I care about. I don't care about any of the rest of it. I don't need you to tell me all, the latest science. I just know that it's working for me. So, people can choose to try this, and can choose to have a very different experience with food, a very different experience with life, I think, because so much potential is unlocked when people are not sick, not mentally ill, and don't feel brain fog, and don't feel exhausted every day. They feel the best they've ever felt. You feel like a superhuman pretty much all the time. And why would you want to spend your life doing anything different? Why would you want to put yourself in a position where you can be ill?
So I'm trying to relay this to how I felt when I was first told I couldn't drink alcohol again. I decided, well, like most people, you defend alcohol like to the nth degree. You say, well, I'm never going to have any fun anymore. What's the point? Life's going to be boring. It's actually the opposite, because you just have tunnel vision. It's like someone saying, what about rice? I'm like, have you ever had rice on its own without fat? Why are we defending rice? I mean, even when you have special fried rice in the Chinese, which I do admit I have done recently, but I pick out the bits that are in there. The actual rice is just a vessel for everything else. Without butter on it, without salt, without seasoning, what is rice? Why are we defending it? And it's like this. I mean, I was just thinking, I was doing a run this morning thinking about what I'm going to talk to you about. When I had the kids, bearing in mind I've had 4 of them, and I know what food they get offered. I mean, what the fuck are we doing giving babies rice cakes? What sort of nutrition is that for a baby to gnaw on, that's covered in a glossy sort of like fruit juice? Rice cakes, when did that become bone growing, neurotransmitter developing, jaw enhancing? When did we stop giving meat to kids? When did we start mushing up potato and rice? And little babies they come off breast milk, the most nutrient dense thing on the planet, full of cholesterol, full of all the B vitamins, and then we give them a fucking rice cake with mashed up potato. I mean, what how did we come away? Because I believe that the best thing for babies to eat is like organ meats. It's soft, chewy, and dissolves, right?
Yeah. And when they're teething, it's really nice to chew on, like a little kind of gristly bone that's not sharp or anything like that. And babies love that, and it's so, I find it so sad to see what we are feeding kids. There's so much processed baby food, processed baby milk as well.
It's awful. It's awful. I mean, isn't it by law you have to have rapeseed oil in baby milk, which is manufactured using petrol to extract it, chlorine to bleach it, and is one of the biggest commodities on the planet. By
I don't know.
law, they put it in, right?
I don't know why people have gone down that road. I think we're just in such a confused environment on our food. We've lost our way so far that we just think food is what you get in a jar, in a packet, and you just give it out and you eat it to whoever's in your family. It's quite interesting that the schools program that we're doing, that I mentioned to you before, where we're now designing a module to take into primary schools and secondary schools, and we're going to really have a lesson plan where kids go through a number of weeks. They get to read food labels, get to understand what the different ingredients are on food labels. They get to compare it. They get to play food detective. They get to understand the concept of what is good food and not good food. And there are differences. And it plants a seed, I think, for the next generation to start just having, some level of consciousness of what they put in their bodies. But what's interesting when you've been piloting this program is that a lot of the teachers have said, you know, because we do say an important part of any child's development is to have meat included. That is optimal for their development. It's optimal for their
How
brain
does that
development.
happen with the 5 a day and all the eat your greens, particularly like highly processed greens flown in from China, covered in glyphosate? But don't get me started on that one. How on earth do you explain to a teacher who just is used to the eat well plate that's 3/4 frigging carbohydrates? How do you explain that red meat is actually good for someone?
Well, I mean, we've got lots of scientific evidence for that, and we say to them, it is critical because there are lots of kids that are at school that are choosing a plant-based diet.
Meat free Monday. Yep. Someone just said, "What the?"
Absolutely, and so many kids are influenced by a narrative that they should be reducing red meat. They shouldn't be eating meat at all, and so so the teachers are accepting of that. The teachers are used to kids not eating meat, and they're saying, "Well, hang on a minute. You've got a lesson plan which is saying that they should be eating meat. Well, why is that?" Well, the reason for that is because it's absolutely imperative that kids, and during the development stages of when they're growing up and they're trying to get to their optimal height, their optimal brain development, their bones for life, all of that, you need to have animal foods in your diet for that to be done optimally. And so it's quite interesting in trying to run a schools program that we're educating not just the kids, but a lot of the people around the kids as well, who need to have this narrative change. So we think it's really important to get into schools because it's where the problems are starting.
I mean, when I first started Will Powders, and we have collagen, and it's grass fed, it's Swiss collagen, completely clean, one ingredient, bovine collagen, you know, it's eating nose to tail. And I'm like, why the hell? It tastes of nothing. You know, all kids do this, don't they? They smell everything. I'm like, why the hell is this not in every single pasta sauce, every single drink? Why is this absolute amino acid profile with so much glycine in that will help their bones, the jaws, the teeth, the eyes, the hair, help them grow elevated? Do you remember they used to have milk, but kids would decide, you know, that they don't want milk or whatever? But I'm like, why the hell is this not being in every single food? Oh, because it's meat based and we're promoting vegetables. Since when do kids like vegetables anyway? They don't like them for a reason. Can you just explain why kids, and why there's this whole movement, particularly underground, why people shouldn't think that vegetables are the bee's knees?
Well, I mean, there's so much science behind this, but vegetables just don't have the nutrient profile that meat has. There are nutrients in vegetables, but you have to eat a lot more of them if you were to not eat the meat. So you can't really replace one with the other. It doesn't really give you anything to do that. Plus, plants are much less bioavailable, and you absorb whatever nutrients there are in those plants at a much lower level than you do what's in meat. So there are multiple reasons why you wouldn't want to ever take meat out of your diet, and you should always keep it in there, and have vegetables to go alongside it. That's fine, as long as they're real vegetables. But for a child to develop without having the absolutely critical aspects that you need from meat is setting them up for something which is going to put them at a disadvantage their whole life. And I just saw the other day that I think we've shrunk the most. We have the shortest children in Europe, or something like that, which is not surprising considering what I just said about schools, that people are just thinking there's a narrative out there that is, you know, in places which influence kids, which is about very much tugging at their heartstrings. It's normally something related to animal welfare, which is not the case for eating meat a lot of the time if you choose it wisely. And it gives them a reason to do it, and they think they're doing the right thing. And we're really keen to make sure that kids know that they and parents know that kids have to be eating meat during their younger years, and staying away from these processed foods as well, like packeted foods and baby foods that are in jars, and, you know, processed formula milk and all of that kind of stuff as much as possible.
So like I said, I've got 4 lads. The oldest is 16, and I didn't sort of understand this journey until he was a little bit older, so about 8 years ago. So number 4 has had a much more paleolithic approach to diet. And it's funny because number one, 2 and 3 will just inhale bread. Number 4 doesn't look at it. He's like, he's not bothered, he'll have meat. And it's funny, it's like the epigenetics, you know, well, when I was pregnant and stuff, it's really interesting how, and you know what as well, it's like you can train them pretty quickly. Their gut microbiome isn't like ours. It's not set in its ways. When we think that they've got cravings, they don't last half as long. So think our, like, say for me, coming off alcohol, the insatiable, and we're talking alcohol here, which is sugar in itself, that skin crawling withdrawal was 3 days, 5 days completely for it to clear my liver.
Yeah.
That's 5 days for the rest of my life to then be sober and free of the grasp of alcohol. And I think carbohydrates are the same. 5 days for the rest of your life to like reduce your shopping bills, reduce the brain fog, reduce your waistline, but that's a byproduct of increased energy and just a general, like, you know, clearer skin. And just there's just loads of advice, like less arthritis, and like you said, freaking Alzheimer's, right? Because that is now, that Alzheimer's is now considered type 3 diabetes, but we don't discuss that in general practice. You don't see that on ITV, do you? They're like, oh, go, you know, treat yourself, have a cake, build your muscles up. What? Have a cake?
I mean, yeah, they do. I mean, especially these charities, they have all of these nice little kind of cake days. You know, come and support our charity while we give you some
cancer. And then if you run a 10K breast cancer race, you get a glass of prosecco at the end. I'm like, the reason why women get breast cancer, 1 in 4, is because of alcohol consumption. And then you're going to give women who survive breast cancer some pink prosecco because it's so twee, isn't it? It's so twee and patronizing, you know.
Which is why you should support our charity, because our charity is the charity that is going to actually change the system and change how we are receiving all of these services at the moment, which isn't great right now, especially in the NHS. For type 2 diabetes, we do need a service, and one of our main projects is actually coaching people who go to their GP, they're pre-diabetic or they're diabetic, and at the moment they might get, they probably will get prescribed something. If they're lucky, they'll get sent off to a low-calorie course. But in the case of our service, which we're trying to roll out, that is the only one which is going to get people to understand the effect of carbs on type 2 diabetes. And it is so important that we start to do that, because it is the only way to get people reversing and going into remission on type 2 diabetes. So this is the kind of, from my point, obviously I'm very biased, but if you're going to help a charity that's doing something like that, and it's not perpetuating the problem.
Taking backhanders from the people that are poisoning you in the first place.
Yeah.
Like Kellogg's or Coke or Mars or Unilever even, or Procter & Gamble, who paid the American Heart Association to say veg oil was good. But anyway, that's not even a conspiracy theory, that's just history. Right, listen, Olivia, thank you so much. I'm going to do a swipe up to your event. I'm going to be there as like a roving reporter behind the scenes.
You want to talk,
and I want to
talk about the tickets, Davinia?
Yeah. What do people want to do if they want to get 2 tickets? We're going to give 2 tickets, and it's in London between the 18th and 19th of May in South London and Croydon, isn't it?
Yeah.
And how do people win a ticket?
So it's 18th and 19th, and on the Monday we've got a workshop, because every year people say they're so inspired, they don't know what to do with all this inspiration. So we're going to have a capturing inspiration day and help people come up with a nutrition plan for themselves, and also think about how they can play a part in the wider change that needs to happen. So it's 18th, 19th and the 20th on the Monday. So please come and support us. We're the exact kind of charity. We need grassroots support. We won't get it from any industry, because we don't make a profit for any industry. We are just telling people to eat real food, and to start this grassroots movement, we need people to support us. The best way to support us is to come to our conference. If you can't come for any reason, you can live stream, but try and be there, because it's a really, really good experience. You learn so much, you meet amazing speakers, you come away inspired and on a high and with a big vibe that everyone just gets into. So we'd love people to come and join us in London on the 18th and 19th of May. And we are going to give away a couple of tickets tonight to anyone who A, follows us, B, if you look on our Instagram profile, the pinned post, which is the lineup of speakers for our conference, if you share that and comment on that post, so share it to your story and maybe say something about it, so other people hear about it, and if you comment on that same pinned post, then we will choose to somebody that can get 2 tickets in the next day or so, and let them know. But if you don't, then please still come, because we're a great cause and we're a great charity to support. If you really want to see change, if you're wondering how on earth is this whole world going to change towards better health, then please support charities like ours that are bringing together people, the public, and the healthcare community all together, so that we can make a stand for really moving towards better nutrition for all of us.
Olivia, thank you so much for your efforts, your story, your experience, your tips, and your bravery, and your bloody resilience to make actual change that benefits us, rather than just more bullshit in the name of health.
Yeah.
But thank you. Your method really does work, and it's you know, it's really inspiring to watch a superwoman like yourself in action. It's really kicking ass.
And yourself, likewise, Davinia. Thank you for supporting us. We really, really, really appreciate
Anytime.
it.
Oh my goodness. So see you all there, guys, and thanks again.
See you in London in May. Thanks, Davinia.
Bye bye.
Night, everyone.